Before I came to Congress, I worked as a nurse in a hospital and a community mental health agency. I had to worry every single day about whether my patients could afford the medication that I knew they needed. It's an awful part of an otherwise extremely rewarding profession. We know that PBMs play a critical role in the pharmaceutical supply chain, but that doesn't mean that drug manufacturers are being let off the hook. Big Pharma plays a leading role in drastically and unethically raising the cost of life-saving medications for the sake of profit and for the sake of greed. Notably, only 3 companies, Optum Rx, CVS Caremark, and Express Scripts, make up a staggering 80% of the PBM market, which we have heard earlier. 3 companies play a central role in making decisions about what medications are covered by healthcare insurance plans and the costs of those medications. PBMs negotiate pricing with drug manufacturers and use these negotiations to determine which medications are covered on someone's insurance formulary. The difference between life or death is a series of shady contracts struck between the drug manufacturer, the PBM, the insurer, and the pharmacy. The end result of this complicated design is patients are expected to shell out thousands of dollars in out-of-pocket medical costs, even for life-saving prescription medicine. Professor Conti, how does PBM control over drug formularies affect the medications patients are able to receive at the pharmacy?
PBMs steer patients to use, in general, the cheapest and most effective drug for them. That includes over a 90% utilization of generics and biosimilars when they're available. This benefits patients and it benefits their health.
My understanding is that PBMs consider formularies, though, as sensitive business information. PBM decisions about which medications to cover and how to sort them into tiers or rankings are generally not available to patients. And as the nurse, I was never able to get that information early. I had to wait until they sent us the book, and this was very devastating and horrifying for so many of our patients. Professor Conti, if a patient doesn't understand why a specific medication is chosen for inclusion on a PBM formulary, how will they know that the price that they are being asked to pay at the pharmacy is a fair price?
They will not.
Thank you. It's clear both the PBM and the pharmaceutical industries are in desperate need of reforms that increase transparency and reduce costs for patients and for pharmacies. In fact, Barnes-Jewish Hospital, the largest hospital in Missouri and the largest private employer in my district, has the following to say about their experience with PBMs, and I quote, "Often pharmacy benefit managers create additional financial and administrative challenges for many providers, pharmacies in particular, and delay or deny patients access to the medications they need," end quote. The biggest hospital system in the state of Missouri is at the mercy of PBMs. They often require step therapy treatments or burdensome prior authorizations before covering medications ordered by a healthcare provider, which is devastating to patients and their care. They lose jobs, they lose homes, they can lose children because they are now unstable on medications. And I'm speaking to that being a mental health nurse that watched it happen to my patients over and over again. They were stable, and then the new formulary came out. Insurance companies, PBMs, and Big Pharma are deciding what medications patients should take, not patients with their doctors, with their doctors. These obstacles compromise patient care at every single turn by denying patients the life-saving medications and the treatments that they need. As a nurse, I've seen it over and over with the patients I've cared for, as I said, who are stable on medication, some for decades. Their care was upended when their PBMs and insurance companies decided that their medication was not profitable. The health and well-being of the people of this country lie in the hands of industries represented right here today. How can we be confident that these companies are acting in the patient's best interest if they face so little competition? People with terminal illnesses, disabilities, seniors, and our most vulnerable members of our community deserve more. I implore my colleagues on both sides of the aisle to enact sensible legislation to drastically reform the PBM industry and get drug prices under control once and for all. Thank you, and I yield back.
Thank you.